Welcome to First Lexington Chamber of Commerce Business Spotlight. Today we have with us Dave Tasto from Assistant Hands Home Care that is located in Lexington. Welcome, Dave. Can you tell us a bit about yourself?
Thank you. Yes. We started helping folks in the community in the Lexington area about 5 years ago, and are happy to have relocated our office, opened our office in Lexington just recently. Now based in Lexington, we're able to help serve more and more of our clients that live in Lexington, but our service area includes many of the towns north and west of Boston. Lexington happens to be more centrally located within our service area, so we're able to help more of those clients in surrounding communities as well. Having our office located close to downtown Lexington, we're very excited though to be able to just walk out during lunch and just go down, grab a bite to eat or do some local shopping in town. Our employees, or caregivers as we refer to them as, help our clients by providing them with extra support daily. And that support could include showers, bathing, dressing, meal preparation, but also transportation services like helping them get to their follow-up doctor appointments, or helping them with shopping, grocery shopping, or running errands. But the support is really there to help keep them living as independent as possible, where they want to live their retirement, which is typically at home.
Great. Tell us about yourself a little bit and about your background.
Sure. I grew up in Minnesota originally, and I came out to the Boston area for college. While at school, I met my college sweetheart, and was fortunate enough to marry her after graduation. I did graduate in engineering and worked for a few different firms and industries in the Boston area for a couple decades. Along the way, though, I did get an MBA, and as I had always wanted to start my own business.
So tell us why you decided to start and how did you start Assisting Hands Home Care?
Well, my story, or my entry into healthcare started a number of years ago. My grandmother was diagnosed with dementia, and she moved in with my mom and stepdad, who became her primary caregivers. And it became, over time, as the disease progressed, it became more and more difficult for them to care for my grandmother, and they didn't have the training or experience to be able to care for her in the way that she might have needed. And it's very difficult to provide this type of care. My grandmother, eventually moved into a community, and as the disease continued to progress, as unfortunately it does, she did move into the memory area of the community, and towards the end she did get some support from hospice. But with the hospice benefit, she was able to get some extra support in the morning, helping get her ready for the day, and that included the showers and getting dressed and so forth, getting her ready for breakfast every day. My mom called a few times while she was living in this community and shared some stories on how the extra support from hospice was just blowing her away. She was so impressed. The caregivers went above and beyond, not just doing certain tasks, but really caring for her and showing that compassion. I was very intrigued by these caregivers, and I kind of looked into more and more of this. I heard radio advertisements for caregiving, in-home care, and the field was very appealing for a lot of reasons, but from a give back and feel good kind of nature as well. I actually had an opportunity though to meet those caregivers that cared for my grandmother. I went back to Minnesota and actually met them at my grandmother's funeral. Not did they care to attend my grandmother's funeral after having worked with her for a few weeks, but they also shared stories similar to probably what my mom saw, on how they did go above and beyond and kept my grandmother smiling at a really tough time. Getting her ready for breakfast during the showers, they curled her hair. She had curly hair, so they curled her hair. She had hot pink fingernails. She liked having her fingers painted, so they put hot pink fingernail polish on her. And during these times that my mom would call me, she said she'd wished if she'd known help like this existed, she might have been able to keep mom at home longer, and that just kept me thinking about this stuff. But Another story that I heard from one of these caregivers that really, really touched me is that she was going through a similar situation with her own grandmother, and she took the initiative to share blouses between her grandmother and my grandmother. And she said that my grandmother was happy, smiling, wearing her favorite new blouse. And it didn't matter, obviously, where that blouse came from or what was going on at the time. And she probably didn't realize much of what was going on, after, having, advanced dementia, hospice-level dementia care. But the compassion in those stories and from those caregivers really touched me. And, on the way back from Minnesota, just in chatting with my wife, I knew that I wanted to kind of get into a field where I could really make a difference in people's lives directly. And I'm happy and honored now to be able to be providing still the same level of care to our clients that my grandmother received.
Dave, thank you so much for sharing such a touchy personal story. What is Assisting Hands' focus, and what would you say is unique about your business?
In addition to providing award-winning care for individuals that have cognitive conditions like dementia, Alzheimer's disease, or Parkinson's disease, we are experts at preventing hospital stays. Preventing hospitalizations and keeping people out of the hospital is critically important. Particularly during the pandemic, no one wants to go to the hospital, but a key metric for us that measures how we're doing in preventing hospitalizations is our hospital readmission rate. And that is a measure of how often our clients, on average, go back to the hospital after a previous discharge. And we're proud, actually, at Assisting Hands to have been recognized as one of the, as having one of the lowest readmission rates in the country for non-medical home care, which has been consistently in the low single digits. On average, nearly 1 in 5 Medicare patients goes back to the hospital within just 30 days of a previous discharge, meaning that coming out of a hospital puts you at a significantly increased risk of having to go back. Okay, this doesn't seem like a natural kind of thing, but there's a lot of things that happen in hospitals. There's deconditioning and some other things that happen that might, increase the chance of having to go back. Additionally, there's a lot of things that change coming out of the hospital. Might have new medications, different, exercises, other things to get back figuratively and literally on your feet again. We probably all know of someone who's been in the hospital recently. Well, coming out of the hospital is a critical time to make sure that we support them and mind a lot of the extra details to help them prevent that return trip to the hospital. At Assisting Hands, we employ our unique thriving at home approach to preventing hospital stays. And this ensures that our clients get the support that's really needed coming out of the hospital as well. But our philosophy is to help provide just the support that's needed. If we're able to help them when they need it and still encourage them to do everything that they're able to, then they'll continue to be able to do everything that they can do on their own. So even if we're not helping them around the clock, when we do leave in the evening, so we finish up our services, they're much more likely to be able to continue safely and live healthy while we're not there providing that support. So it's more of a philosophy that kind of guides our approach. But our strong communications with families and other care providers and our extensive caregiver training do bolster this thriving at home approach. And this approach is really all captured in a book that I wrote recently called Thriving at Home, a handbook for preventing hospital stays.
Dave, it's very interesting information you shared, but let's talk more about your book. Can you tell us why you decided to write the book, Thriving at Home?
We are intently focused on preventing hospital stays. And in particularly during the pandemic, we found that we needed to work with family caregivers if we were really focused on keeping people out of the hospital. As often, after our shift ends, it's really, those family caregivers that are often providing that extra support, keeping their loved ones healthy at home. In home care, I've seen firsthand, though, how, individuals can age in place and live their retirement where they want to. But maintaining your health at home is very important to living your retirement where you want to. Hospital stays and going back into the hospital can be very challenging. There can be unintended consequences, and I mentioned the deconditioning. There's a lot that can happen coming out of the hospital. Again, this is not to disparage hospitals, because hospitals can provide the best care when needed. But if we're able to avoid going to the hospital, we can do everything we can to try to prevent that trip. As I mentioned, the family caregivers are providing a lot of that support. They did during the pandemic, but even these days they're providing a lot of support for their own loved ones. But most don't have the formal training that our caregivers do or experience in caring for folks. And many of those family caregivers could be providing support for children. So they're in this sandwich generation of needing to provide support for their elderly parents, but also maintaining a household, getting their kids off to school, and doing all the daily activities, managing a house. At Assisting Hands, our care team does a lot to keep our clients living healthy at home, but family members are providing a lot of this support. I decided to write Thriving at Home to help share the knowledge that our care team has and the experience and the best practices that we've learned over the years. If we share this knowledge with family members who are caring for their loved ones, it's very likely that our clients are going to have much better health outcomes and probably, be more happy at home. Also, the book is helpful to help promote the awareness of resources that are available for folks in the community or families in the community, but also what type of care options are available at home. Thriving at Home helps inform and educate family caregivers on what they can do to keep their loved ones healthy at home and out of the hospital. Now our trademarked Thriving at Home approach ensures that the solid communications we have helps connect other healthcare providers, and allows us to escalate prior to a crisis that would, cause a trip to the hospital.
Okay. So thank you for sharing about the book. Sounds like Thriving at Home is a great resource for many families. Now, as a Chamber of Lexington member, I know you are involved in many areas in the community and in many organizations. Can you please share with us a little bit about your involvement and what you do for the community?
Yeah, there are a few areas that I'm involved. I volunteer for my kids' elementary schools. During the pandemic, they needed some extra support during lunches, so I was able to continue, with the flexibility that I had as a business owner, provide that support during the day and help out where they needed it. I also was involved in a special program that helped kids stay more active during recess. So I was out running around or taking walks with kids and keeping them more active. Being on the executive board of the Bedford Chamber, though, I can help advocate for other businesses, drive increased awareness for resources that they might need in the community, but also help connect them or members of the chamber, similar to your role, with other local businesses in the community. In addition, I've spoken to many other local organizations about Thriving at Home, including Rotary, other councils on aging or senior centers, nonprofits, support groups, about Thriving at Home and informing family members on what they can do to keep their loved ones out of the hospital.
So can you tell us a bit more what families can do to keep their loved ones out of the hospital?
There are a few key things, that's captured in the book, but, fall prevention is a very important piece. And that really involves, identifying hazards in the home and removing them. And these are trip hazards in the home. The number one reason older adults go to the hospital is because of a trip or a fall. So ensuring, this basic household safety can really go a long way to prevent those, trips or falls at home. Also, I briefly mentioned, managing health at home. Certain chronic conditions require extra level of diligence, and managing those conditions at home is very important, because these chronic conditions like chronic obstructive pulmonary disease, or COPD, also heart disease or diabetes. Folks with these conditions are at a significantly increased risk, higher than the 1 in 5 that we spoke about earlier. So, ensuring that their medications, as an example, ensuring that their medications are being taken, that they're eating healthy meals and exercising as needed. These are all things that can be done at home and help reduce the risk of a readmission or admission in the first place. Also, they can also escalate to healthcare providers if there's abnormal symptoms or things that they might notice that's going on with their loved one. But knowing what's abnormal is being familiar with what is expected or normal for their given condition. A quick example, like in diabetes, it might be that for a low blood sugar condition, lightheadedness or dizziness could occur. That is an expected or a normal kind of condition or a symptom that is associated with diabetes, and there are non-medical ways to address that. Every patient is unique and has their own guidance, and folks should speak with their healthcare provider for this guidance, but these are some of the examples of non-medical things that they can do at home. Also, I mentioned, contacting their healthcare providers. Everyone should stay close with their healthcare provider or their primary care provider at home, and building that relationship and level of communication between those providers is critical, so that they're aware of what's going on and can help assess a situation should a crisis situation occur, and you do need to reach out to those healthcare providers, when you need to escalate.
So Dave, what challenges are you seeing in the community, and what would you say are opportunities out there for similar home care businesses like yours?
I'd say there's probably 2 key areas that can really be addressed or focused on. Isolation and transportation needs. We have seen that many individuals in the community have suffered from loneliness or isolation. There are many cases and studies that show that engaging in regular communication or social connections does minimize the impact of isolation. In fact, earlier this year, the Surgeon General acknowledged that we are in an epidemic of loneliness, and that it is taking a toll on our individual and mental health in the country. Increasing social connections has shown to counter the physical, mental, and emotional impacts of loneliness and isolation, while supporting everyday needs. Our team can build those relationships and connections with our clients to minimize the impacts of loneliness and isolation. In transportation, having access to transportation does provide access to the essential services that we all need to live live at home independently, and that could be, follow-up trips to doctor appointments, getting groceries, banking is often needed to, to pay for things, but also, picking up prescriptions and making sure that we have the right medications on hand to manage our health at home. Also, just, getting our clients to social activities, meeting with their friends or visiting family members that might be in a nearby town, is really critical. Our services really can address both of these, the isolation and loneliness, but also, the transportation, whether we're providing support through companionship, but also just getting them out, to go shopping locally.
Thank you. Thank you for sharing that. And how would you say Assisting Hands is giving back to the community and helping our residents here in Lexington?
Well, we are very proud sponsors of a memory cafe that's put on by Jewish Family and Children's Services out of Waltham. And this is really intended to bring joy to individuals and the care partners for those who are living with dementia in our communities. And it provides regular social connections. We also support and sponsor efforts through local elder services organizations, helping bring awareness and visibility to the resources and tools that they provide members of the community. Something we're very proud of is that we're an approved VA home health aid program provider. The VA provides many valuable resources, health care services to veterans, but the home health aid program allows us to provide the home care services that we can provide other individuals in the community, but we also now are able to provide them directly to veterans. And these services are provided to veterans at no charge, whether they're living at home or in a community like an assisted living community or other retirement community.
Thank you, Dave. Thank you for all the great things that you are doing for our community. And thank you all for watching Lexington Chamber of Commerce Business Spotlight.